Hello, friend. As you ponder whether you should or could retire abroad, is the question of healthcare access and availability and quality, is that a concern for you? Well, if it is, this video is for you today. So keep watching. Hey there. The question that we want to address today is healthcare abroad a concern for older expats? Should it be a concern for older expats? Well, I think so. I know you agree. If you want to move to a country, you want to really invest time and energy to research the system there and do a comparison with what you're familiar with. If you're from the US, and most of my comments are going to relate to the US healthcare system, which is the one that I'm familiar with. And most of my subscribers and people who watch my videos are in the US, and I'm not making any assumption. I'm sure that there are some from other countries as well. But I think it is a universal concept that we should pay attention to, that if you're moving to a new place, especially in our age group, we want to ensure that we will have access to quality healthcare, however we decide quality. And I think today in this video, I want to take you through I'm big on factors, the things that you should consider as it relates to the accessibility and the quality and availability and cost of healthcare in the country that you are thinking of expatriating to. But before we go any further, I have to reintroduce myself to you guys. I am Maggie. I am a retired nurse practitioner of over 43 years. Yes, I know I don't look that old, but I am. I'm going to make you laugh. And I have retired here to Panama since January 25th, 2023. So let's see, today is the 20th. So I have 5 days up until my anniversary, second anniversary. I am so grateful. Look at this. I am happy. I am at peace. I am joyful because I'm here in Panama. Not that I look really bad over there, but the concerns, the anxiety I had over there, I don't have here. So thank you, Panama. Thank you. I am also the creator of SWRA, Single Women Retiring Abroad, a group of sassy older ladies who have made a conscious decision to retire here to Panama, live our best life, create sisterhood, community, and while we are reinventing ourselves. Because, if in our 60s, we could live another 25, 30 years. That is a whole new lifetime that we have to craft. I am so excited. I am doing these videos, I'm creating, I feel energized, and I'm just so grateful to the universe, to God, for putting me in this place and giving me an opportunity to grow so I don't feel like I'm just, slowly dying. Because retirement doesn't have to be like that. It's the beginning of a new lifetime. So, to the topic at hand, my job is to help you move to another country, to Panama, in a painless way, making sure, giving you the tools you need to do the work that it takes to assess your suitability for being an expat, helping you through the steps you need to do to get to the point where you transition to your new home. And then when you get here, we are here to support you, to welcome you. This is what SWRA is all about, a support system for single older ladies who have chosen to make Panama their new home. But last two videos, the first video I did, like I think on the first of the year, January 1st, was no, what did I say? On the third, on the first, I don't remember the title, but I think the last two videos, one of them was like the dark side of becoming an expat, the whole process. I impressed upon you, upon you that it's not all glamorous, that there is a dark side to going through the process, all the emotional things that we go through. And then in the last video, I helped you, uh, you know, getting through the process of saying, should I move abroad? If you do the assessment and you say, oh, check, 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 yeah, it says I can. But then the step two is, even if it says I can, should I? Okay. And I gave you the process of determining all the factors you needed to look at to get to that point. Now we're getting into the nitty gritty, right? Finances. Number two is healthcare, healthcare cost. But we want you to start with the state of your own health. Okay. If you are someone who has unfortunately gone through a lot of different major illnesses like cancer and other things, and you've had multiple surgeries and you're very fragile in health, and you need to be close to your healthcare team. You need to have regular PET scans, you need to have regular lab work, and you're a little bit fragile. This is the best term I can use. Should you consider moving abroad? That is a personal decision, but I will give you my take as a provider that it may not be the best decision if you're in a fragile state of health and you need to have access to your healthcare team that knows your doctors, your therapists, your physical therapists, your nutritionists, everybody's there. That's a tough decision, right? But at the same time, I always say, what is your why? You may have an issue that supersedes that. I don't know. You're going to have to decide for yourself if that reason is stronger than you being close to your healthcare team. Okay. So your state of health is a big determinant as to should I even go further to assess, the quality and access to healthcare wherever I plan on going. The other thing you want to do also is look at your own personal health. Let's say you did not go through all these other major surgeries, right? You didn't have cancer, but are you healthy? What is your state of health? Do you have issues with obesity, smoking, diabetes out of control, blood pressure out of control, mental issues out of control? You got to think about those things, even though when you come to a place like Panama, and I'm not just talking about anything else because that's what I know. A lot of people who come here have been taken off their blood pressure medication and their diabetes is under control. Like my friend the other day, she's like, my A1C is 5.7. This is the very first time in a few years I've had an A1C like that. Panama has that effect on you, whether it's the lower level of stress, the quality of the food, and that general, what I call joie de vivre, you're enjoying life. Okay. That goes a long way in keeping you healthy. So look at your personal health. And maybe if you say, okay, I want to move to Panama, but let me work on myself first, you could do that. That might be one of those reasons where you say, maybe not now, maybe later, but also keep in mind that when you cross the pond and you come over here, it might get better. Personal decision. So having said that, number three, I want to tell you is as you consider a different country, your history, your current health, the other thing I think is vital is your concept of health. What does that mean to you? I say that, I'm sure somebody else has said it, that health does not necessarily mean the absence of disease. Being healthy doesn't mean that I've never been ill, I've never had cancer, I've never had anything. Who is going to live anyway? To be 66 and said, I've never had anything wrong. I'll never forget, I was watching a program one day, and this little 93-year-old, she was doing a little exercise, and I was like, oh, yeah, this is great. And somebody asked her, is everything okay? Do you have any issues with arthritis or anything? She's like, no, no arthritis, nothing, nothing. And I'm sitting here thinking, okay, you mean to tell me you lived in this body for 93 years and nothing has gone wrong? Mm-hmm. I did not believe what she was saying, you know. But some people are so into, they're doing all these exercises. This lady gets up at 2 a.m. and goes to the gym, and she's like in her 80s, but she's drinking, what is it again? Egg whites. And I'm like, okay, lady, are you thinking that you're going to live forever? None of us is going to escape death. Yes, we need to live a healthy life, but let's not go crazy. Death will still get you, okay? Just keep that in mind. So, your concept of health, I have come to believe personally, to believe that if God has blessed me to be this age, 66, it's a blessing. And those of you who know me know that I try to stay as healthy as I can. I'm not perfect. I'm not 100% all the time. I fall off the wagon a lot, eating the croissant that I know doesn't agree with me, the rice that I ate yesterday for my gumbo, all these things I know. But I'm a human. I'm not a tree. I'm not perfect. I don't do everything right all the time. So I've decided that I don't want extreme measures to prolong my life. That's Maggie, okay? So you're not going to see me say, oh, I need a policy that's going to be able to fly me back to the US if something happens that I can get the best care. Mm-mm, mm-mm. I say to myself and to my family, to my daughter, who is my, surrogate, it's like, if anything happens to me, let me get treated here. Whatever they can provide here, that's all I want. That's all I need. I don't need you to fly me anywhere to find the best care, the latest, the brightest, enroll me in studies. No. So you have to decide for yourself your level of comfort with the care that is available where you are thinking of expatriating to. That makes the decision a lot easier. It makes it easier for you to accept what is available. Okay? Right. 1, 2, 3. All right. Let's keep going. So before I explain to you, I came up with a few factors, you know me, I'm big on factors to consider as you are vetting those places, those countries in terms of their healthcare program, right? Let's think about the system that you know now, the US healthcare system, that everybody tells you is the best around the world. Is it? Have you read any articles lately that tells you that the US spends the highest amount of money per capita, that means per citizen, on healthcare, yet it ranks last in healthcare outcome? Okay, so the US, for for you to kind of compare, in 2022, the US has spent $12,555 per person on healthcare. Compare that to 8,049 in Switzerland, 6,938 in Sweden, and Deal Panama in 2020, 1415. Why are we paying so much in the US, but yet the issue of access, equity, outcome, death? So don't believe everything that you hear. The US healthcare system is rigged. It is based on the capitalistic notion that it's all about making money. It's profit over patient. In my nursing career, we hear that every single day, how people are denied this, denied that. Okay, so some possible reason for this crazy picture that is the reality of the US healthcare system, in my view, as a nurse and also as a provider, for the time that I was a provider, I feel that consumer expectations are one reason people, the cost of healthcare is so high. People go to the doctor with their list. I want this, I want this, I want that. And, some doctors will say, don't check Google because, even I say, ask Dr. Google. And then even though you should be your own advocate, okay, there are horror stories also of doctors not paying attention, like all these stories of colon cancer in young people, go to the doctor saying, my stool's different, I have blood in my stool, I have pain. Oh, that doctor said, well, you lost your mom, you probably stressed, and would not order an MRI. Ugh, makes me shudder. Okay. And also, I think that, our expectations that everything's going to be done, just like I said, I don't want everything done, but somebody will say, do everything, like an adult child telling a doctor as they're treating a 95-year-old, do everything to keep mom alive. Come on. The other thing that I think about is we want to live at all costs. We bought into the idea of eternal, I don't know, I don't want to say deity, but it's just like we're not going to die. Who was it? Was it Disney who had their body embalmed and just waiting for whatever research finding is going to, for a while there, I wondered, why do I have to die? Why do people have to age? And like I said, nobody answered that question. It's just the way it is. So when you get to a point and you can say, okay, I accept it, your life is going to be a lot easier because none of us gets out of dying. And if you live to be in your 50s, 60s, what about the babies, the children, the young people? We don't know. We don't know. Fear of dying, and also a litigious society in the US. Everybody's suing everybody. I got sued as a provider of home care over something simple. You have children, adult children, who are wanting to create wealth out of, suing a provider. Sometimes there is gross malpractice and negligence, but most of the time it's just general error. We are human beings. We're not perfect, right? So fear of being sued gets these doctors, these providers to just order all these tests over and over again. Duplication of services, don't get me started on that. Testing, double testing, duplication, high cost of drugs, medication that costs, a few euros in Europe. In the US, it's like triple, quadruple. Why? I I gotta tell you this. I had a little patient who had a boil on the back of his shoulder. Uh, I think he had like a MRSA, a bad infection. And then, of course, the hospital was like, we can't keep you all these days for you to get your treatment. We're going to send you home on this medication and an IV pump. And as a nurse, as a home care nurse, we were called to coordinate all that. But true to form, medication wasn't covered by any insurance company, definitely Medicare. Medicare said, look, I'll pay for your doctor, your hospital, the rest of it, you're on your own. So when I got to these people's home, they were living in a trailer. It was a little older man with his wife. When I got there, they were both in tears. And I said, what's wrong? She said that 10-day medication that the doctor prescribed cost $1,700. And I'm like, oh my God, how did you get it? She said, we had to put it on a credit card. And here I'm talking about not being in debt in your older years. This is the kind of inhumane system that we have. Okay? Polypharmacy is another thing. That means multiple medication. I went to the UK. I was in Manchester for 3 weeks and I studied the NHS system. And every factor, they were killing us in terms of outcome, they did better. Diabetics, they had less incidence of people losing their limbs. Cancer, breast cancer, people did a lot better. When you move to a community in the UK, and I guess it's the same in France, you give your address, you are assigned a center, a medical center in your neighborhood where your care is coordinated. You get your doctor. So everything you need done goes through there. There is somebody managing your care. You don't get to decide, I want to go here, I want to go there. If you need to go to a specialist, your doctor has to sign off on it. Yes, you may have to wait to get a knee replacement or whatever, but there are good things about universal health care. And nobody wants to talk about that in the US. Oh my God, that makes you a socialist or a communist. Oh my God. Okay. So polypharmacy, you have a patient who has a primary care doctor. The doctor make a referral to an endocrinologist to manage diabetes. You get a pulmonologist to manage your asthma. You get a nephrologist to manage your. So what you go to the medical school for? You can even manage diabetes. You got to get somebody else to manage asthma. So before you know it, you have 15 providers. They're all writing prescriptions, and nobody knows. The left hand doesn't know what the right hand is doing. And then this person ends up with like a bunch of medication. As a home care nurse, when you get into a home, you say, "Can I see your medication, please?" Sometimes we spend 2 hours in the home. And most of that time is looking at medication, eliminating duplication, trying to call a doctor and say, "Mrs. So-and-so is taking 3 of the same medication. Oh, yeah, she was in the hospital last week for hypertension, low blood pressure, because she's getting 3 different medications. Sometimes they're taking a brand name medication, sometimes they're taking a generic, and nobody knows what's going on. And the poor patients in the middle at the mercy of that system. So we create more problems. People, you go to the hospital or to the doctor, they give you a medication and you say, "Oh, it gives me this problem, that problem. Oh, here's another prescription." Prescription to treat the side effect of the original prescription. Okay, I need to get off that soapbox because that bothers me. So polypharmacy. And the other thing in the American system is a high administrative cost. They have to hire a whole room full of people to handle the denials of your claims. Did you know with this United Healthcare person, who got gunned down, sadly, no one should die that way. They talked about the denial rate of United Healthcare was like 30 to 32%. That means 30 to 32% of each claim is denied. And I personally believe, my experience, like with dental claims or whatever, they find a reason to deny you automatically, and then you have to go provide more information. And I believe in their psyche, it's like, well, maybe if she gets annoyed, she'll just pay and we wouldn't have to pay her. Okay, so I think I made a case to tell you that it is not all that it's cracked up to be, the best US healthcare system that you think. No, they pay the most money and they do worse in healthcare outcome and how they manage their patient. The other thing I want to say, and I know I need to move on, don't forget to like, share, and subscribe. Come on, you're getting me all worked up. Thinking that in addition to the system issues that we have in healthcare in the US, you have the other side, the societal issues, the inequities, the way they treat people who they consider to be low class, people who are of a different skin shade. They get the worst end of the stick in terms of, are they enrolled in research? Do they get the best treatment? Do they get referred? The data is out there. It's a very inequitable system, and I don't want to use another word. You know what I'm thinking. I think I read somewhere, someone said, "Tell me your zip code and I will tell you how healthy you are." I personally saw food chains, supermarkets who, they carry healthy fruit and vegetable. They would close that shop because it's in a very depressed neighborhood. It's all about the profit. They don't care about the health of the population. People in lower socioeconomic situations, and you tell them, oh, yeah, you need to eat well, exercise. Yeah, yeah. Why don't you live a day in their life and then talk about eating fresh fruits and vegetables? All right, again, another soapbox. I apologize. Let's get to it. Okay, the person who says that I have a long intro, well, today you're going to be really mad. A really long one. I have to get it off my chest because when you're considering moving somewhere else and you keep saying, oh, well, we're not going to get the care that we get over here. Are you really getting the best care over here? Open your eyes. What you need to ask yourself these questions. Do they have private health care or universal health care? That makes a big difference. In Panama, they have private health care, but somewhat of a public type of healthcare because you can go to a clinic and pay like $2 to get something, and some people may not pay anything. And when you go to a hospital, you get things done for pennies. So you may not call it universal healthcare, but it is very cheap and affordable care for the citizens. You go to Portugal, you go to France, you need to know what type of healthcare system they have and study it. Okay? Can foreigners participate in the public health system? Well, I don't think it's written in stone, but here in Panama, if something is wrong with you, you can go to a polyclinic, you're going to get seen. They're going to ask, they're not going to say, oh, you have an e-cedula, you're not a cedula, you're not a resident, you can't come here. There is none of that here. You can go anywhere. But we do have public hospitals and we have private hospital. And of course, you're going to pay more at a private hospital, right? That's why we say you have to have your credit card with good credit. Something happens to you, and then you can go to the polyclinics and pay like $2, $5. Someone said, my friend said the other day, someone told her this lady was in a hospital somewhere in the interior for like a week. And I think her bill was $29. Now, I don't know how true that is. And to me, that's like, what? But people have had hernia repair for like $300, gallbladder surgery. So we can afford those. Compare that to what you would have paid back home. Okay? Is public access available to foreigners? I just said that. Yes, you can go anywhere. So when you don't have insurance here in Panama, you can choose if you have to have like surgery, you can choose to go to a public hospital, and it's going to be much cheaper. Now, if you're very bougie, you're going to say, "Oh, I'm not going to go to a public hospital." Well, but I am told that you need to bring your own sheets and your own pillowcases. So with the sisters, I'm talking about the emergency bag. So I guess now I have to add a couple of sheets and pillowcases in there just to make sure you're not laying on the plastic mattress. Oh my God. The average cost of healthcare. Okay. So I already told you that in the public system, things are very cheap. In the private system, they're a little bit more expensive. I don't have a handle on what costs what, how much for an MRI or whatever, but whatever the cost is, it is a fraction of what you would have paid at home. Okay? Now, I'm going to talk about Medicare in a second, but if you go to a public hospital to have like major surgery, you're going to pay some thousands. Okay? So be ready for that. So that's why you have to consider whether you need to get a healthcare insurance plan, depending on your age. Okay. The state of the hospitals. Now, people have gone to some public hospitals and say it wasn't fancy, but it was clean. Of course, if you go to the Panama Clinic or Panama Pacifica Salud, one of those private hospitals, it's quirky and pretty. Okay. So the cost is based on the hospital and whether you're going to share a room with someone or whether you want private. If you want privacy, you're going to have to pay. Okay? Now, in terms of insurance plans, okay, this is where people ask me, can I get health insurance in Panama? Yes, you can, but if you less than 64, you can probably apply for one of the Panama sponsored insurance. And I'm not an insurance agent. I can't tell you the details. If you really want specific information, you need to contact an insurance broker. Okay. I'm just telling you, vaguely. If you are less than 64, you may have access to Panama sponsored health insurance, or you can have insurance from other places, international, Blue Cross Blue Shield, Aetna, Cigna, you can have those. But if you're younger, your rates are manageable. Okay. Some of them may still have pre-existing condition clauses. This is a big thing here in Panama. It's like, we'll give you the insurance, but you have to be really healthy. If you have hypertension, diabetes, we don't really want to touch you. Or who doesn't have something at our ages, right? And the way the pre-existing condition might work is that they might say, well, we don't want to touch anything that is remotely related to this condition for 12 months, for 24 months. So there's a delay in coverage. And when they do, it might be at 70-30, where you're responsible for 30%. Okay? If you are over 65, chances are your choices are very limited in terms of over 64. In terms of those two insurances I talked about for people over 64 won't even touch you. Pre-existing condition is a big thing after 64. If you've had cancer, forget it. They're not going to cover you. But if you have other illnesses, the same thing. They might say, we won't cover you for 12 to 24 months. But your choices are limited to like an international plan, like Cigna, Aetna. I think they have one for Blue Cross Blue Shield. But of course, it's pricey. The older you are, the more expensive. In Panama City, we have two choices. There was a hospital called Hospital Santa Fe that has a program. It's the hospital program itself. It doesn't have any age limit, but it does have pre-existing condition clauses. So that means you're going to be accepted. Most, if not all, insurance companies will want you to have a physical with lab work. And with our age group, they want X-ray, EKG, mammogram. They want to be sure you're not bringing anything in before they cover you. And then your rate will depend on the results. They sit together, they look at your lab and say, okay, we're going to up her rate this and that. But at least that's one option. If you're 85, you can subscribe to Hospital Santa Fe. You can apply. Now, the other thing to understand with this hospital is that you are limited to having procedures, and your hospitalization has to be in that hospital alone. And it is in the city. It's in an area that's like, but you cannot decide to go to Pacifica Salud when you have a Hospital Santa Fe plan. Understand that. There is another hospital called San Fernando that is here in the city. Also, you're limited to that hospital, but at least this hospital clinic has a clinic in the Coronado area. Someone told me they're building a hospital in Coronado. I don't know. Someone said they're building, is it another hospital in Chiriquí? Because you do have a hospital in David where people who live in Boquete, that's their hospital. But I think I heard that they're going to have another hospital anyway. So if you're interested in those areas, make sure you join those Facebook groups and ask those questions. They will tell you, okay? Quality of medical personnel. In Panama, most of the doctors are bilingual. A lot of them have done internship, residency outside of Panama, and they're fluent. But that does not mean the nurses, the technician, and the other staff speak English. So make sure you know some Spanish or have your translator with Google Translate ready. Okay? And what is really beautiful in Panama is that the doctors who work in the private sector are required to also do some work in the public sector. So you are guaranteed a seamless, the quality of your providers is seamless. It's not like you only have the lower You know what I mean? Lower quality doctors in the public, and then no. So that's good. And the other thing too, the private sector, not private sector per se, but the doctors, the primary care physicians who see you here in Panama, I have heard nothing but the best thing about those doctors. Their bedside table, the way they care for you, the way they spend time listening. The first visit is long because they get to know you. Do you have that at home? Do you have that at home? How long does your doctor spend with you? Okay. So when you tell me you're missing that over there, I'm sorry. I'm sorry. Okay, don't get me started on another soapbox. I don't want to get back on another one. Okay, so good quality, English speaking. The nurses usually don't speak English, so sign language, Google Translate. Use of Medicare Advantage. This is important in our age group. Now, the other option for you also as somebody my age is that you can buy a plan from Aetna, all these other international insurance companies. They will take your money. Just going to cost you a little bit, but that's a choice you have. In addition to Hospital Santa Fe, the plan from San Fernando Hospital, those are the two that you can consider. And then you can buy international plan. Okay? Some people don't want to hear about Medicare Advantage. Maybe they had bad experience or they've heard bad things about it. And they're like, nope, keep your Medicare. And they like to go back to the States every so often to get things done, which is fine, sis. Sir, you do you, okay? But Medicare Advantage plans will cover you in Panama and other countries, anywhere around the world in an emergency only. You know, the questions always swirl around in those Facebook groups. Can I use my Medicare? No. Straight Medicare? No. Okay? But the issue we were having here in Panama was that if you had a Medicare Advantage, for example, United Healthcare, which is the one I joined this year, don't feel sorry for me, Argentina. Yeah, I was like, after I heard about this guy and the denial rate, I was like, oh. But anyway, so yes. So when you get a Medicare Advantage plan here in Panama, it used to be when you get to a hospital, okay? Now, private hospital won't ask you for your credit card. You just have to settle before you leave. But if you go to a private hospital here in Panama for any reason, if you don't have one of those international plans, they want your credit card and they do an advanced billing. They kind of say, oh, she's coming with this and that. Oh, it might cost $1,500. They will bill your credit card, give it back to you. That way they ensure that they get paid. Then they treat you. At the end of your stay, they will tally all the charges. And if you have a credit, they will put it back on your card. But they weren't going to bill. And then they would help you. Maybe they'll give you the claim and you can send it to your insurance plan and pray that you get paid. You know, then you get started with the same system of denial. And yeah. Now, Jackie Lang, who has been here forever, and she's in the Cherokee area. I'm sure you've watched some of her videos. She's been working with a billing company to help the hospitals here bill for the claims without asking for our credit cards. And I think that's happening already in Hospital Cherokee in David. But now I am told that as of February 2025, this year, this billing company is been working with the hospitals here in the city to do the billing when you get admitted and you have a Medicare Advantage plan. And mark your calendar, January 30th at 6 p.m. Eastern Time. Jackie's going to have a live session with the billing company where they're going to explain how it's all going to come about. Okay? So we have options. Personally, I have the Medicare Advantage plan. I don't have another private plan. I've been healthy, thank God. So what we do, we self-fund, which means we put some money on the side that if we need to go see a doctor, we have a cold or whatever, then we can pay out of pocket, because the insurance, the Medicare Advantage plan is for anything that would require like an urgent care visit or hospital visit. So that's most everything, right? And you can pay to do your screening, and if you get, a little bit of sniffle or something. The only thing that I see that might be a problem, I mean, if you're diabetic and you have your whatever, I have a friend who's diabetic, she sees her doctor regularly and she just pays for the visit. And the visit could be $25, $30, it's not going to break the bank. The same goes for your eyeglasses, your ear, your hearing aids. I guess you're going to have to pay for those. Those you pay out of pocket, okay? To get your teeth clean, you pay for those, and it's not going to break the bank. Most of us can afford those, okay? So I'm thinking that the problem we may run into is if you become, you have things like cancer or something else that requires, dialysis or something. Those are not considered emergencies, so you could not use your Medicare Advantage for. So those you have to pay out of pocket. So you got to be ready for that, sis. Got to be ready for that, for the eventuality. Okay. The other thing you might want to ask is long-term care available? If you want to come here to live the rest of your life, yes. They have long-term care facilities. They even have some that manage people with dementia, where they have secure unit, I would say, for people like that. And I was reading that Thailand has really been capitalizing on this dementia long-term care for people out of Europe usually, but it can be done. And I think a lot of people are thinking about that here, because when they see a lot of us come and they're like, whoo, they see dollar sign. But me personally, SWRA, we're not interested in the assisted living type of model. Some sisters might. Personally, Maggie, I'm not. Okay. Is dementia care. We talked about that. Private health, home health care. Yes, and not sure. You can hire people to help you privately. There are a couple of private help organizations. I tried to call one to help one sister out, and they were charging a lot and they were not available. So the same thing that I went through as a provider of home care services, it's still here. So it's a work in progress, okay? Acceptance of DNR. They do not understand what do not resuscitate mean. First of all, I need to tell you that all your advance directive paperwork probably not going to work here. Okay? So you can talk to your doctor privately, but I don't know that it's a thing for you to be writing notes and putting the yellow form on your door, that kind of thing. And the last thing I have, the burial process. Yes, the funeral home companies, they are very familiar with the expat, and they help with the paperwork. If you want to get your body shipped back to the state, most of us here in my circle, we want to be cremated. So just pay for the cremation, and you could just put me underground under a tree, around a tree or something, and I become fertilizer. My daughter had asked me that one time, and I was like, now I'm like, oh yeah, I want that tree to look good. Or somebody can come and take your ashes in an urn. Very easy. But you do have option if you want to be buried here as well. So just call any funeral home company and they'll help you. They're very familiar with the process. In conclusion, if you are considering moving abroad, you ought to pay attention to the healthcare system in that area, in that community, in that country. And I'm telling you, compare it with yours, because yours is not that great. So you got to make a decision as to what you can live with. Your personal philosophy of health is going to help. If you want to live forever and you want all the bells and whistle and you want everything done, if you're a hypochondriac, it's going to cost you. So, and then if you decide, no, I like the spanky, quick, shiny, the way we do things over there, it's okay. You do you. Okay, my God, I need to stop. So I hope you got a lot of information. When somebody asks me, can I get health insurance here. I hope I just listen to the video, watch it over and over so you get an understanding. And if you need a referral to like a insurance broker, I'll be glad to provide it. I am not an insurance broker. I cannot give you cost and detail, but they're very good at giving you the information that you need. All right. Whew. That was a lot. So I hope you enjoyed this one and that you learned a lot. Remember to like, share, and subscribe. My goal is to help you repatriate successfully, that you go to a country with your eyes open, that nothing is a surprise to you. Okay. And we are here. If you have any questions, I'm happy to answer them. Okay. That's it. God loves you. I love you. What did I say? I'm so bad at it. God bless you. Au revoir la prochaine. Bye.